Welcome back. As the highly transmissible Omicron COVID-19 variant has now been confirmed, found in 16 states across the U.S., and health experts saying it will likely be detected in the city within a number of days, Chicago teachers are on high alert regarding the virus. Elsewhere, COVID-19 vaccine mandates continue to be a topic of debate. Some countries struggle to encourage a voluntary take-up of vaccines, which are proven to greatly reduce the risk of severe infection, hospitalization, and death from the virus. Well, some governments are considering or have already stated that they will introduce compulsory vaccinations. Well, joining us to talk more about this from Chicago in the U.S. is Dr. Damilola Adeyemi, Infectious Disease Section Head Chairman, IPC Program, Swedish Hospital, North Shore University Health System. We'd like to thank you for joining us on the program.
Thank you for having me.
I'd like us to begin from the COVID-19 vaccine mandates. What's the situation where you are?
Yes, thank you for that question. So basically, employers have mandated employees to get vaccinated. We have evidence to show that people who are vaccinated are protected from this infection. And on the rare occasion when they get infected, they're not as sick. They just have mild disease. They rarely need to go to the hospital, and they very, very rarely die from this if they're vaccinated. The vaccine mandate, it's a lot of issues with that. In my organization, it was implemented, and employees who decided not to be vaccinated are currently not at work. This is just because we take care of patients, and we want to make sure that patients have a peace of mind when they come into our institution, that they're going to be taken care of by people who are fully vaccinated, and they're not going to get infected from being in our institution.
But
and apart
Dr.
from
Adeyemi,
that,
does that mean that they're fired or?
Well, basically, they have a choice. They can. Technically, yes. This was not done immediately. It was done in phases. So they were given the opportunity it's over like 2-3 months to get vaccinated. Initially, they were put on no pay. They were still on the list of employees. But starting December 1st, those people are no more here. And they're always welcome to come back. We're doing this for their own good. You also have to know that if you're vaccinated, you're also protecting grandmas, people who you live with, family members at home. We all have different family members who have different medical conditions. Some of them immune compromised. Some people have cancer and they're taking chemotherapy. So they're even if they're vaccinated, their system does not, work as well as you and I who don't have all this condition. And so that helps to protect our family members as well.
So essentially, for the overall benefits, it appears to favor. But let's talk about Omicron. Doesn't that put a clog in the wheel in the argument of vaccines, seeing as even though we heard from our earlier guest that all of the data isn't there yet to know if the vaccines can protect against Omicron variant?
So that's a good question. The argument is actually in favor of getting vaccinated. So the Omicron variant that we have now, yes, we know that it does have some genes that predict that it has an increase in transmissibility as well as risk of evading the immune system. But we also know that if you are vaccinated, and I've seen this clinically, people who come to the hospital who've been vaccinated and get infected, they have mild disease. So the vaccine will still protect you. And what we say is, if you're eligible to get a booster, you should go ahead and get your booster. The people who are boosted are rarely going to get any form of infection from this variant. It will overpower the Omicron variant, is what our speculation is. And like I said, this is all speculation. And if you look at data coming out of South Africa, a lot of people who are having the infection are younger people who are not vaccinated. Amongst their older population who have been vaccinated, I think almost 57%. Those are not the people who have been admitted to the hospital or who have been seen. It's majority people who are younger that are getting infected. Unfortunately, from reports we have so far, these have been mild infections. But it is too early to say. It is too early to say. We need some more time and some more data to be able to make definitive conclusions. But overall, the vaccine, getting vaccinated is our only way out of this pandemic.
Let's
and
look
not
at
just
schools.
vaccinating
Okay.
people in the
Go
US.
ahead.
Sorry, beg your pardon?
Yeah, just
And not just
land on
vaccinating
that
people
note.
Sorry, not just vaccinating people in the US, it's vaccinating everybody in the world, because otherwise we're just going to have new variants coming from, Kinshasa, from any part of the world where the vaccination rate is low and the virus has the opportunity to just, invade and multiply. And these variants come because the virus is multiplying and dividing, and there will be mistakes. And that's why we have a new variant. So overall, we all know the vaccines work. And our only way out of this pandemic is to vaccinate almost everybody, actually, is to vaccinate everybody. And so my last message would be, if you're not vaccinated, please go and get vaccinated. If you're vaccinated and you're eligible for a booster, please get boosted. Get your booster shots. And above all, please continue to observe those mitigation strategies that we talk about all the time. Try to wear a well-fitting mask when you're in an indoor place where there are other people. Try to social distance as much as possible. Avoid large gatherings. Wash your hands, and just observe those things where we can end this pandemic if all this is done.
Another thing that I keep thinking is if we can get a vaccine that can perhaps stop transmission, maybe that would be, that would really help.
Yes, the vaccines that would really help. But we've gone. If we had this vaccine at the beginning of the pandemic, if this vaccine was available, millions of lives would have been saved. Millions of lives would have been saved. The goal of the vaccine right now is to prevent you from getting sick and needing to go to the hospital or dying, which is the ultimate. I get where you're coming from, that people can still transmit this, but if you're transmitting and you're not getting very sick, and you don't need to go to the hospital and you're not going to die from it, it's
half bread.
Exactly.
I understand. We appreciate your time. Thank you so much. We've been speaking to Dr. Damilola Adeyemi, Infectious Disease Section Head Chairman, IPC Program, Swedish Hospital, North Shore University Health System. Thank you for joining us on the program.
Thank you for having me.